I want to talk about hypnosis in practice, because many people listening who are brand new to this topic, they may think of the word hypnosis, they may think of how it's portrayed to them in films and television of just people falling asleep. But what is hypnosis in practice?
Lewis, it's more like waking up than falling asleep. The thing that scares people the most about hypnosis is the idea that they're losing control, that some weird guy is going to dangle a watch in front of them and make them do things. It's really a way of gaining control over yourself. The fact that you can be open to being different, to try out what it is like to be a different kind of person, means you can do that for yourself. And that's what I want to do, is teach people hypnosis is just a state of highly focused attention. Have you ever gotten so caught up in a good movie that you kind of forget you're watching the movie and enter the imagined world? That's what hypnosis is like. It's been called believed in imagination. So what you do is you focus very intensely. You put outside of conscious awareness things that would ordinarily be in consciousness, which we do all the time, by the way. Right now, I presume you have sensations in your back and your bottom touching that nice black chair you're sitting in. Is that right?
Yes.
But I'm hoping you weren't aware of that until I brought it to your attention. If you were, we could just stop now. So our brains are filtering out tons of information in order to concentrate on what you want to pay attention to. And in hypnosis, you do that more intensely. So now it's like looking through the telephoto lens of a camera. What you see with great detail, but you're less aware of the context. And perhaps the coolest thing about hypnosis is this capacity to kind of get over yourself, to try out being different and see what it feels like. And we know what's going on in the brain when that happens, but I think of hypnosis more and more, Lewis, and I've used it with about 7,000 people in my career. I think of it more and more as a way to sort of set aside your usual assumptions of who you are and what you are, and try out being different. It's a way of changing in a hurry, of making yourself into someone different and see if you like it. And so it's sort of like one of those apps on your smartphone that you just haven't used yet, you haven't opened yet. It's an ability the brain has that we just don't take full advantage of. And hypnosis is a very good way to do that.
And on a deeper level, when you are reaching a state like that, as you mentioned, of hyperfocus, what is actually going on in the brain? What is changing on a deeper level?
We've used functional magnetic resonance imaging, Lewis. It's a technique in which you go into a scanner, makes a fair amount of noise, and it can magnetize and demagnetize your brain in a way that you can see the anatomy beautifully. You can image the anatomy, but also the function. You can see where there's more or less blood flow, and the brain allocates blood flow based on activity, on what it's doing. And so it's a very powerful way of seeing what happens in the brain. And what we've discovered, taking high and low hypnotizable people, putting them in the scanner in and out of hypnotic states, is three things happen. One is you turn down activity in what's called the dorsal anterior cingulate cortex. The cingulate cortex is like a C on its ends, right smack in the middle of the brain. And the anterior part, the dorsal part of the anterior cingulate cortex, is our alarm system. You can think of it as sort of like the alarm system in your house, if you have one, that you set it at a certain level and something will happen and it'll go off. And we call it the salience network in the brain. It's part of the brain that says, boom, there's a loud noise. You get distracted. You have to see what's going on. That's your salience network saying, could be trouble, better do something. And in hypnosis, you turn down that activity. So we found in one study that the more deeply hypnotized people felt, the less activity there was in the salience network. So the part of your brain that could distract you is kind of going to sleep, saying, do whatever you want. I'm not going to worry about it. So that allows you to absorb yourself more deeply in what's going on. The second thing that happens is the executive control network up in the prefrontal cortex, which hopefully you and I are using right now to have this discussion, is hyper connected to the insula. The insula is a little island of tissue. Insula is Latin for island in the middle of the frontal cortex that is a mind-body relay. So it's a part of the brain where the brain can control what's happening in the body, and where also it can perceive what's going on in the body. And so you have hyperconnectivity there and people in hypnosis can do remarkable things. They can put outside of conscious awareness pain. They can focus intently when good athletes are, doing their best. They can be in a state of highly intense focus and control their bodies well. The head of the Stanford swimming team, the coach, got in touch with me once because he found that these women who were superb swimmers, many of them wind up in the Olympics, were swimming better in practice than they were in meets. And he thought, that's weird. You'd think normally you get your adrenaline pumping, you do your best. But what we discovered was that they were getting distracted by the women in the other lanes during a meet. Now, swimming isn't a contact sport. It doesn't really matter what the women in the other lanes do. What matters is how you're relating to your body, the process that you're going through. And so I had them do self-hypnosis and just focus intently on you swimming your best race without worrying at all about what else is going on. And as they did that, they learned to tune into their body and how they managed their body and how they responded to the pressure of the water and the way they coordinated activity in their bodies. And they wound up swimming faster in meets because that's what they were trained to pay attention to. So that's mind-body activity through the insula. The third thing that happens is that you get inverse connectivity. So when the prefrontal cortex is working, when you're deciding what to do, like you're doing now, you inhibit activity in the back part of the cingulate cortex. That's the posterior cingulate cortex. We call it the default mode, part of the default mode network. And the default mode network is kind of what's going on when you're not doing anything in particular. And you wind up thinking about yourself, reflecting on who you are, what your parents wanted you to be, how you turned out, what you should be. I call it the my fault mode network, the part of your brain where you get troubled about yourself. And it can sometimes it helps you set standards for who you are and what you are. But sometimes it's that part of your brain that says, oh, you can't do that. You shouldn't do that. Why would you do that? And so it can get in the way of changing, of being different. And in hypnosis, you can inhibit that part of the brain and allow yourself to try out being different. So, when people I hate these stage show hypnosis things, but it scares people. They think, oh my God, that guy took control of the football coach and made him dance like a ballerina and all that. And, I get it. I understand the concern. But you know what? It's actually an interesting lesson. It's actually teaching you how to try out being different, doing something that you would never ordinarily do. And that's a bad example of a good thing. Because if you want to, if you say you're in pain and the pain is distracting you and it's awful and it scares you, there are two things going on. There's probably something wrong with some part of your body that's sending signals to the brain. But there's also something about the way you respond to it that you can actually control. And if you just broke your arm, you want to pay attention to it and get it fixed. Or if you're having crushing substernal chest pain, you may be having a heart attack, you better get to the ER. But a lot of time, the pain we live with is different. It's something that is an annoyance. It's a reminder there's something wrong. You got to take care of it, but you don't have to let it hijack your attention. So I have people in hypnosis change the way they manage pain. Imagine you're doing something that actually gives you relief. You're taking a warm bath, or you're putting an ice pack on it, and get your brain into the same state it's in when you're actually doing that. And you know what? You can alter pain. So that's where changing your presumption about who you are and what you have to do and be is something that can actually change how you feel, can reduce your pain, reduce your stress. And so that's why I say hypnosis is like an underutilized app in our brains that can help us modulate how we feel, what we do.
When you were talking about that example of the Stanford swimming team there, I think a lot of people will be thinking, that sounds like an amazing thing to achieve that sort of level of focus. And there's actually in the UK, darts is a really big sport. Okay, it fills out it genuinely fills out arenas of 20,000 people. And
It's just pubs that it's
no, it's a big thing in the UK. And there was recently the World Championships, and this is in front of thousands and thousands of people, millions of people actually tune in the UK. It's a huge thing. And there was this one darts player who, as you mentioned there, I was thinking of those swimmers, brilliant in practice, always says, but when he's on the stage and he's against other people, his game would just completely fall apart. And he was talking in an interview at the World Championships about how he's been working with a hypnotherapist to dial in his focus and just play his game and block everything else. And it reminded me of those swimmers you were talking about. So when someone is going through hypnosis to work on something like that, what does the actual practice look like, and how long of a process is it to bring someone to that state?
It can happen very quickly, and I want to start out by saying that for anybody who's interested, we've built an app called Reveri, Reveri, that's available on the web, www.reveri.com, or through the App Store or Google Play. And you get to hear my mellifluous voice showing you how to do exactly what you're talking about, among other things, how to focus. And it's a very simple and quick thing where you have people, first of all, get their body comfortable. You start with your body up. And imagine you're floating in a bath, a lake, a hot tub, or floating in space. Because a lot of the problems with concentration that people like this, your darter, is that the right term, darter?
Yeah.
Oh, good. Is that instead of focusing on how he relates to his body, he's focusing on the competition and the people, and what he'll have to say if he didn't do as well as he hoped he had. And what you do is you focus on your relationship with your body. You get your body floating and comfortable, and then you think, how can I focus now on how I manage my body so that it does what we want? There's a book called Zen and the Art of Archery, and it's about the sort of Zen approach to, and archery was in the East is a popular like darts. It's not so different actually. And his point is that most people's mistake is to focus on the target, and you're thinking, wait a minute, what the hell else are you going to do? But he said, in this book, he points out that if you do that, you're disconnecting yourself from your body and the bow and arrow. And what really matters is how you relate to the bow and arrow. And if you do that well, the arrow will wind up where you want it to go. And in the same way, this guy needs to focus on his relationship with his arm and the right amount of muscle tension and the right movement in his arm that will get the dart to go where he wants it to go. And so hypnosis is a way of shifting and enhancing focus, narrowing the focus of attention. But in the case of sports performance, not really on the target, but on the way you manage your body so that it can do its best. And so that you find it, not tension, but enjoyable. We had a football. Joe Montana was a fabulous football quarterback here, American style football. And he used to say that he would do these fantastic passes, 40, 50 yards down the field. And Jerry Rice was there with his arms in the right place. And he said, I knew when I let go of the ball whether it was going to be caught or not. 40, 50 yards down the field, 20 other guys running around, knocking each other down. And it's that capacity to intensify mental focus that hypnosis can really help you do and learn to do. And there are many good athletes. Tiger Woods, who trained at Stanford for a while, does hypnosis every day to enhance his ability to concentrate. And many good basketball players do it. I see them look up and close their eyes just before they take a foul shot. It's a way of just connecting with your body and focusing on what you do control, which is how your body reacts.
A lot of the videos I've seen of people being hypnotized, as you mentioned there, they look up with the eyes before you close. What is that trying to achieve when you look up to the sky before closing your eyes?
What you're trying to do here is turn inward but remain alert. And a lot of our concentration ability has to do with our eyes. What do you do when you go to sleep? You close your eyes. What do you do when you're dreaming? You have rapid eye movements. Drugs that affect level of arousal will either dilate or constrict the pupils. So the the parts of the brain that control eye movement are surrounded by another part of the brain called the reticular activating system in the brainstem that helps to set our level of alertness and arousal. So it's a way of going to the part of our perceptual process that allows us to concentrate intently, but without going to sleep. Hypnosis is waking up, it's not going to sleep. And so it's not the only way, but it's a quick way of saying, I want you to remain alert, but turn inward. So instead of scanning the environment, which can distract you, you want to be able to turn inward, focus on what you want and on your relationship to your body.
I love, and you've said this a few times now, that hypnosis is about waking up, not going to sleep. And I think that's the complete opposite of what a lot of people would go into this conversation assuming. So
Right.
when we are seeing examples of, and I know you've mentioned showmen where you see people go into sleep through hypnosis, is that to say that that is all smoke and mirrors then?
No, there are, there are lessons to be learned from stage hypnosis. It's not using it in a way that I like or am comfortable with. But what the thing that's a bit deceptive about many of these shows is you can't do this with just anyone. And you'll notice that. Have you been to one of these stage hypnosis shows, Lewis?
Not yet, but I'm planning on in a couple of months. I'm planning to go and see it for myself in person.
Okay, good. There are a lot of people do it in Great Britain. I spoke at a UK hypnosis convention last fall, and there were some people there who do the shows. It's kind of interesting. But the first half of the show is a kind of sifting of the audience. So they'll have a few people come up. They'll have them do some hypnotic thing, like, your arm is stiff as a bar of iron. I can't push it down. And they're surprised by it. And you can change the way your arms feel. I've hypnotized people and had them, pull their hand down. It wants to float right back up in the air. And we can try it if you want. But people differ in their ability to experience hypnosis. So hypnotizability is a very stable trait. It's about as stable as IQ in adult life. And so some people are very hypnotizable and you can do all that stuff with them. Some people aren't. And so what they do at the beginning of the shows is filter out that, maybe a quarter of the audience who really are pretty hypnotizable, get them to come up. And others, they'll try something out, have them sit down and try someone else, or they'll stand in front of the audience and move back and forth and see who tends to be swaying with them, until you get a few people who are very hypnotizable. And then you can do the stuff with having them stretch between two tables and, push down and their bodies are stiff and that sort of stuff. So it's not that he can do that to anyone or she, they can't.
And so when you are testing someone's hypnotizability, let's say, as you mentioned, do you have to be right in front of the person and actually doing a practice on them? Or, as you mentioned, is this something you can maybe gauge from afar or a distance? Or,
well, I've hypnotized thousands of people remotely through video audio setup like ours. So no, I don't have to be in the room with them. I can give them some instructions and evaluate how they respond to them.
So that's fascinating. That is remotely. How would you say, what steps would you take to sort of gauge how hypnotizable I am then if we're on a video call thousands of miles away?
Well, the first thing is the way your eyes go up. It turns out that there's a relationship between your ability to detach lowering your eyelids from lowering your eyes that seems to be an initial good predictor of how hypnotizable you are. So I'll ask you now to just look up past your eyebrows all the way up. And as you keep looking up, slowly close your eyes. Look up, close, good. So you would be at least a good mid-range subject, 2 out of 4. You can open your eyes now because you can do that to some extent. I can see part iris, part sclera, the lower whites of your eyes, as you're beginning to close them. And you find it a little effortful, a little hard to do. Is that right?
Yeah.
Yeah. So hypnosis is a way of mobilizing your maximal resources. And I would say that you should be at least moderately hypnotizable. You ever get so caught up in a good movie that you forget you're watching a movie and enter the imagined world?
Yes, quite often.
Yeah. Yeah. So that's what hypnotizable. So I would say you should be at least moderately, maybe highly hypnotizable just based on that.
And I wonder how important is it that someone believes they can be hypnotized to be hypnotized, as opposed to someone who is, dead set against the idea and convinced that it doesn't work?
Well, there's sort of two answers to that question. You don't have to believe in it. You just have to try it and see what happens.
Mhm.
And there are some people who are very skeptical about it, who wind up, in a hypnotic state. My late father, who has used hypnosis since he was a soldier in World War II, using it to help people who were wounded or in pain, was doing some studies with it. And one soldier in the ward he wasn't working with stormed into his office and said, "How come you haven't asked to hypnotize me?" And he said, "Well, I hadn't gotten to you yet." And he said, "Well, you couldn't hypnotize me even if you wanted to." And my father was using a piece of paper with a dot in the center to have people focus on the dot. And the guy looked at it and his right eye closed. And my father said, "Well, how come you can't open your right eye?" And he said, "Well, my left eye is open." And my brother said, "Good, now close that, take a deep breath." And he was off. He was in hypnosis. So now it doesn't matter. But there on the other hand, people who are sort of tend to be critical and judgmental about everything tend as a rule to be less hypnotizable. They like to judge and evaluate first. Whereas people who are very hypnotizable just kind of soak up new information, new things, and can let themselves go. And that can be a tremendous advantage. You can affiliate well with people. You can embrace novelty, but sometimes you can get yourself in trouble because you are, not judging enough what's going on. And that's a good thing to learn about yourself.
And you alluded to this type of hypnotism earlier, and it's in the video on YouTube. There's a video of you and Andrew Huberman where you practice hypnosis on Andrew Huberman, and you
Right.
you get this sensation in his arm where he's wanting to raise his arm and it feeling completely different to the other. What is going on during that exercise specifically, and how do you achieve that sensation of someone wanting to lift their arm or feeling like it's weightless even?
It's very rapid. You just have them look up, close their eyes, and I give them an instruction about how their arm will feel. And I love this. I mean, Andrew is a big, tough, smart guy, and I love that look on his face. It's the element of surprise. That's what you get, where he's looking at his hands, saying, "What in the hell is going on here?" And that experience is something that involves intensity of focus. So you're affiliating with a premise about how one arm will feel different from the other. You're dissociating your usual awareness, and you're dissociating your sense. Why would I allow this guy to help me rearrange how I feel about my own body? And so it's those three things that go on: your connection with your body, the narrowing of the focus, and the suspension of your usual expectations about who you are and what you are. And that's something that you can do very quickly in hypnosis.
When someone fully understands how that works, so once you explain that to Andrew Huberman, for example, and he understands what's going on in the brain, how that's working, is that able to work again just effectively, or does it have slightly less of an effect when someone understands what's going on more?
No, it works just as well. And in fact, you wouldn't know that, but the video, the YouTube video of my testing his hypnotizability happened after he had done a 2-hour interview with me for his podcast.
Mm.
So he got the full explanation that you're getting. And I think he was surprised that despite all of that, despite understanding what's going on in his brain reacted that way. It nonetheless, it worked. So it doesn't matter if it's been called the suspension of disbelief. You just see what happens and let it go.
Mm. The last thing I'd like to talk about in terms of on the subject of stage hypnotism, I've alluded to it a couple of times. So the biggest sort of stage hypnotist in the UK is Derren Brown. He's a massive figure in the UK, has many, many specials and series on our major TV platforms and does these sold out arena shows. That type of hypnotism, I wonder if you've got an opinion on the shows that maybe Derren Brown does and his approach, and whether you think that that's ultimately a good thing for the subject of hypnotism or slightly damaging.
Well, I don't know that I've seen one of his shows, but I get the concept, and I've seen stage hypnosis. I have mixed feelings about it, Lewis. You know, Hypnosis is the oldest Western conception of a psychotherapy. It's been around for like 250 years, and yet it's sort of a sideshow. And I don't like the fact that sometimes those things either, they're entertainment. They sometimes make people look and feel foolish. I don't like that. And it can give it a bad name. It can make people afraid to come see people like me. On the other hand, it reminds us that there's something going on there that's pretty interesting and unusual. And I just wish that the interest that is stirred up by shows like this could be directed more to saying, look, this looks unusual and strange now, but you can really help yourself with your pain, with your anxiety. You can help you to stop smoking. 1 out of 4 people that use Reveri to stop smoking stop right away, just like that. And the rest cut down by about 50% on how much they smoke. Now, that's a real advantage. That's a public health thing. Opioids, in the United States last year, 118,000 people died of opioid overdoses. We have not yet succeeded in killing anybody with hypnosis. It just doesn't happen. And yet it's a powerful pain reliever. We get 30% reduction in pain just starting to use hypnosis to control pain, which is not bad, and it's not habit forming, and you can't overdose on it. So I understand there's some value to acquainting people with it, but I think it scares off a lot of people. They think this can't be a serious treatment. But that's like saying that, because there were snake oil salesmen for drugs, that all drugs are snake oil. They're not. And hypnosis is not either. But we're not in the position we deserve to be in, given how good the phenomenon really is. And that troubles me.
Well, and I think, you mentioned your app there. I've not had the chance to try it yet, but I'm certainly going to go away from this and give it a try, as we've been talking.
Good.
In terms of the investment then, so you mentioned some examples of what this app can help people do, manage pain, anxiety, stress, smoking. In terms of the actual exercises people are following along with the app, what sort of time investment is it involved? Because I think a lot of people might have this misconception that it's a very long, drawn out process, but what sort of investment do people have to put in to get something out?
Well, the exercises in the Reveri app, Lewis, are typically about 10 minutes long. And so we found that 4 out of 5 people who use it for stress management, for example, get a 20% reduction in their level of stress in 10 minutes. Now, that's quicker than a drug, right? Because if you get a prescription, you got to go to the pharmacy, get it filled, take it, let your body absorb it and see what happens. You can tell within 10 minutes whether it's likely to help you or not with your problem. Phobias, pain, stress, anxiety, insomnia. People just fall asleep much more quickly. In fact, we get frustrated. We try to get pre and post measures of stress. That's how I can tell you 4 out of 5 people get better in 10 minutes. With sleep, a lot of people were using our app, but they weren't telling us how they felt because they just went to sleep. I'm not going to respond to you and tell you it's now 4 rather than 8, but so it can happen very quickly. That's one of the other cool things. And that's one thing, Lewis, that differentiates it from mindfulness, meditation, which is a very interesting phenomenon. It's sort of swept the West. And there are a lot of good things about cultivating open presence and compassion and all that. But you're supposed to do that like twice a day for half an hour. You're not supposed to focus on solving a problem. You're just supposed to focus on being different. And it takes a lot of time. And with hypnosis, it's about doing more than being. Use the change in state to change the way you're managing your body and the way your body feels. And that's what you can do with hypnosis. It's quick.
I think that's a really interesting point because a lot of people might sort of blend the two in their mind, hypnosis and mindfulness. But if, say, for example, you were going to deliver some form of hypnosis to me right now, how different would that look to someone delivering a mindfulness session or a meditation to me?
Uh, I would be much more directive about what you should do and how and when you should do it.
Yeah.
I would expect you to feel different in a hurry. I mean, the thing with mindfulness is open presence. Just let the thoughts and feelings flow through you, but don't try and do it to solve a problem. And so I would be instructing you how to handle your pain or stress or whatever it is you wanted to deal with, and hoping that you could do that in a hurry.
Mm. And I guess another fear of people is that there are potentially dangers involved in hypnotism, especially if they practice it on themselves and that there's no one around with them. Are there any dangers to hypnotism and self-hypnosis in particular that people should be aware of?
No, Lewis, all hypnosis is really self-hypnosis. And I'll tell you, I was a little worried. We currently have at any one time 27,000 users. So while I'm talking to you, I'm helping more people than I did in years of my clinical practice. I was a little worried about it, frankly. There's my voice having people go into hypnosis all over the place. And, what might come of it. And so far, the number of so-called adverse events is less than 10. And there were one or two where I had to get in touch with people and help steer them on the right path. But out of, we've had 850,000 downloads. We've had a lot of people using it. And we hear from people if, there's a problem. And, there are a few people who got more anxious instead of less, who had more pain. But again, less than 10. And there was one woman who said, I found myself sitting on my patio feeling unusual sexual feelings. And I thought, well, is this a problem or is this something, good? So it was not, I've been myself surprised at how little difficulty there were, because all hypnosis is really self-hypnosis. You're just learning. And what I'm doing is teaching people to use it better, use it more constructively, use it to make their lives better.
One area in particular that really interested me was hypnosis for anxiety, stress. This is something that I've suffered with for many, many years. I've been to the GP many times. I've been prescribed all sorts of mindfulness exercises, meditation, things like that haven't had too much of a direct impact, in all honesty. But in terms of hypnosis to approach something like anxiety and stress, topics that the individual doesn't really understand, what does that practice look like specifically for those elements?
Well, I can describe it or I can try it with you if you want to give it a try and see what it feels like.
Yeah, absolutely.
Okay. So get as comfortable as you can. On one, do one thing, look up, all the way up. Before we start, how on a scale of 0 to 10 right now, how anxious are you feeling?
A little bit more now that we're getting into it. But yeah, I'd say quite apprehensive at the moment of how this is going to go. So I'd say maybe a 6.
6? Okay, good. Thanks. Now get as comfortable as you can. On one, do one thing, look up, all the way up, high as you can. 2, do 2 things. Slowly close your eyes and take a deep breath. And 3, do 3 things. Let the breath out, let your eyes relax, but keep them closed. Let your body float. And then let one hand or the other float up in the air like a balloon. And that's your signal to yourself and to me that you're ready to concentrate. So let one hand or the other float up with your hand over the middle of your chest so I can see your hand. Good. And I'm going to give you this instruction. Your hand will remain light and up and in this upright position even after I give you the signal to shift gears and concentrate on something else. Later, when I ask you to pull your right hand down using your left hand and then let go, the right hand will float right back up to the upright position. You'll find something pleasant and amusing about this sensation. Later on, I'll ask you to touch your right elbow with your left hand, and your usual sensation and control will return. You'll find something pleasant and amusing about the experience, and we'll use it to help your body relax. Now, please take your left hand, pull your right hand down, and let go. Now, with your eyes closed and remaining in this state of concentration, can you describe what you're feeling now in your right hand?
It feels very, very light. There's a little bit of tingling around my knuckles.
Okay. By way of comparison, please raise your left hand. All right, good. Put your left hand down. Are you aware of a difference in sensation and control in your left hand going up compared to your right?
Definitely, it feels a lot more labored in the left hand.
In the left hand.
Yeah.
So over which hand would you say you have more control right now?
Definitely my left hand.
The left hand, good. So you're aware of a relative difference in control, good. Now I want you to use that experience as a lesson about how you can change sensations elsewhere in your body as well. So I want you to imagine you're floating in a bath, a lake, a hot tub, or just floating in space. Each breath deeper, and then slowly exhale through your mouth as you breathe. And imagine you're floating in a bath, a lake, a hot tub, or floating in space. How is your body feeling right now?
Very light.
Good, light. Where do you picture your body being?
In space.
In space, good. So please notice how quickly and easily you can use your stored memories and your imagination to help yourself and your body feel better. How would you rate your current level of stress right now?
Very, very low.
Good, good. Like, can you give it a number from 0 to 10?
0, 1.
0, 1. Excellent. So notice how quickly and easily you've been able to use this state of self-hypnosis to help yourself and your body feel better. Now, what I'd like you to do next is picture in your mind's eye an imaginary screen. It could be a movie screen, a TV screen, or a piece of clear blue sky. And first picture a pleasant scene on the screen and tell me what you see.
Really open fields, mountains.
Good. And notice how that makes you feel. Feel pleasant the way you would feel being in a place like that?
Yeah, definitely.
So you can use your stored memories to help yourself feel better. But let's suppose something is stressing you right now. Please divide the screen in half, keep your body floating, and picture on the left side one thing that's making you feel stressed right now. But with the rule that no matter what you see on the screen, you keep your body floating and comfortable. What do you see on the screen?
A lot of fire.
A lot of fire. Interesting.
Yeah.
Where is the fire?
It's just sort of like all encompassing the screen.
All encompassing. Okay. Well, it's not an uncommon experience these days. But how's your body feeling?
Still very, very light, especially the right arm. Can't really feel it. It's like, yeah.
Now, use the right side of the screen to picture one thing you can do about the problem on the left. What do you see on the right side of the screen?
Obviously, direct response to fire, war, first responder action, things like that.
Good. Okay. So you can picture yourself doing things that would make a difference. And your body is still floating and comfortable?
Yes.
So notice how quickly and easily you were able to conceive of something that could make you very anxious. But by doing the one thing you certainly can control, which is how your body reacts to the stressor, you're already taking steps to mastering it. And then you can use your clearer thought to use the other side of the screen and picture what you can actually do about it. So you're quickly able to handle and face the stressor in a way that leaves you and your body feeling more comfortable. Good. Now, take a few moments to reflect on what this means to you in a private sense. Take your left hand and touch your right elbow, and then let go. That's good. Count backwards from 3 to 1. On 3, get ready. 2, with your eyelids closed. Roll up your eyes. 1, let your eyes open. Hand float back down, make a fist open, and that's the end of the exercise. 3, 2, 1. I see you nodding and smiling. That's a good sign. How are you feeling?
Very, 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 very light, very calm, very relaxed. That's
Good.
That's amazing.
Really?
Yeah, it feels
So
amazing.
it surprises you, huh?
I guess the first sort of question that I have about that is what is exactly going on in my brain there during that process?
You've turned down your salience network. So your threshold for feeling uncomfortable was lowered to a point where even picturing something that would cause you stress didn't. Your brain was better able to control how your body was reacting. So by picturing that image of floating up in the air, your body was able to affiliate with that image and act as though you were in a situation like that. And then you were able to shift your expectation about how you would react in situations like that from, oh, I get all tense and I've got to react physically, to realizing that if you can get your body calm and comfortable, you can actually think better about dealing with the problem than you might have thought. Does this surprise you a little that you can react to stressors that way rather than tensing up?
Yeah.
One of the things that people who have chronic tension have to deal with is what I call the snowball effect. That once you get anxious, you notice your body start to tense up, and then you say, "Uh-oh, this is not good." So you get more anxious, and then your body reacts to that, and it's like a snowball rolling downhill. It just picks up speed and size. And if instead you say, "Well, I'm going to approach this differently. I'm going to comfort and help my body first, and then figure out how to deal with the problem," you interrupt that snowball effect of physical and mental stress, and you feel better.
And what was going on with really my right hand there? Because the feeling between the two, this hand felt very, very labored to pick up. Like I got immediate sense that I had to make a real effort to lift it up. Whereas this hand, towards the end, I forgot it was there completely. Like it didn't feel like it was attached to my body. It was really weird.
Yeah. Well, your brain was resetting your relationship to those two different arms. And with one, the sort of mental image that controlled your arm was one of saying, let it just float up and feel light and do what it wants. You were sort of disconnecting it from the usual labored, I got to take this and do that and pick this up. You were just allowing it to feel different. And your left hand, by contrast, I think, was feeling more labored than usual, but you had more of the traditional control you have over how you move your body. So a lot of it is just, changing the programming script between your brain and different parts of your body. And you could experience two different programs that you could invoke very quickly and you could end very quickly. And it shows you that we have a much wider array of abilities to manage our bodies, how they feel and how they function, than we give ourselves credit for. And hypnosis is the shortcut, the brain hack to doing that.
It having experienced that, it sort of answered a lot of questions for me in terms of around this subject. When I mentioned that video with Andrew Huberman earlier. When I watched that video originally, I remember thinking, I'm sort of convinced that I wouldn't react in that way, that I would have a lot more, control over that hand, that and I was thinking, part of me when I originally saw it, a little bit skeptic. I think, is he maybe playing a lot? But genuinely, having experienced that, I really fully understand it a lot more, and I really appreciate the topic, and I'm so excited to go and dive in further now and check out the app and everything we mentioned. But
that's great.
What are some of the biggest misunderstandings around this topic that people have then? Because I clearly had a few.
Yeah. Well, first of all, I encourage your listeners to give themselves a try with the experience. And we built Reveri to give you an opportunity to do it. The first week is free. You can try it out, see how it feels. And I hope people will give it a chance and try out what it feels like to have the same kind of discovery experience that you've had, because it's quick and easy, and it can be helpful. Misunderstandings, the biggest one is loss of control. The idea that somebody can make me do anything they want, and was your experience of me that I was making you do something or teaching you to do something?
Teach, yeah, it felt like it was like an instinct of my own to do, very much my decision, but you were sort of guiding me to do that.
That's exactly it. And I'm glad you feel that way. And that's what I intend. And that's what it is. All hypnosis is really self-hypnosis. I'm just teaching you how to do something that you have within yourself the capacity to do. I'm not making you do anything. And, if you really thought this was terrible, you've got an audience of witnesses here, you could have stopped it and said, I don't know. I assume you felt that if you wanted to, but you didn't want to because you were doing something interesting and learning something about yourself. And so it's not losing control, it's gaining control. It's not somebody taking over control of you. It's you enhancing your control of you, discovering you can do things you maybe didn't think you could do. So that's a learning and growth experience. It's not a sense of being controlled.
Amazing. And just one more topic I'd love to touch on.
Sure.
One area of hypnosis. So we sort of talked and we demonstrated the hypnosis for anxiety, stress. But one of the things I was most surprised by when I was looking into your work is that hypnosis being used for pain management, which may surprise a lot of people because that's a physical pain as opposed to a mental pain. So how different is that approach?
Well, Lewis, the strain and pain lies mainly in the brain, if I can steal something from My Fair Lady. And if you think about it, we all have this common, very serious misconception that pain is only about the body, the physical input. It is always, the brain sits inside your skull and it learns about what's going on in the body and in the world based on input that comes to it and how it processes that input. And so pain is not just about physical input. That's part of it. But it's also about the interpretation the brain makes of what the input is. And so we did an experiment with Stanford students years ago where we gave them a series of shocks to the wrist. And we recorded what we call a somatosensory evoked response. So it's basically EEG response time to measure the effect of the shocks. And we got a standard waveform when we just gave them the shocks, that P100, the sort of little peak that comes a tenth of a second after the shocks, P200 a little bigger, and P300 3/10 of a second. And that's the part of the response that has to do with, is it novel or surprising or scary, or is there something you're supposed to do about it? So we then hypnotized them the way I hypnotized you and had them filter the hurt out of the pain. In this case, imagine a cool tingling numbness that your hand is in circulating ice water. Gave them exactly the same shocks. The P100 disappeared. So this means that at a tenth of a second after these shocks were administered, the brain was reacting differently to it. It was saying, there's nothing there I need to worry about, to hell with it. The P300, which normally gets bigger when you have to respond on the basis of the input, or it's a surprise or novel experience, that was cut by 50%. So the brain, in the way it processed those signals in hypnosis, was literally reducing the amount of pain you felt. It wasn't just your reaction to the pain. The brain was filtering out a big chunk of the sensory input. And other investigators have shown using MRI that if you tell people to just filter it out of the pain, you get reduced activity in the somatosensory cortex. It's where we process physical sensations. If instead you say, well, it's there, but it won't bother you, so it won't set off your alarm system, you get the same degree of analgesia, but now it's in the anterior cingulate cortex. So the part of the brain says, should I worry about this or not? So we have a tremendous ability to process pain signals differently. We've been able to show during surgery, inserting catheters throughout the body and things like that, that we can, with hypnosis, reduce pain substantially to the point where it just about disappears. The anxiety levels disappear. And patients in the control condition everybody could push a button and get opioids in their blood, had 3 times as much pain after an hour and a half of the surgery than the hypnosis group did, and far more anxiety. The hypnosis group had no anxiety at all. I thought they were dead or something. They were fine. And they had fewer procedural complications. They got done with the procedure faster. So people make this terrible mistake, Lewis, and that is, if you can do something to modulate the pain psychologically, it isn't real. It's all in your head. Nothing could be farther from the truth. Pain is always a combination of physical input and the brain's reaction to that input, and you can manage that. And it is so much safer and more rapidly effective than opioids and other pain meds. Now, there are times when you need them, when you should use them. But your listeners should know that, for example, after a surgical procedure, if you are still on opioids 3 days later, every day you're on, you're more likely to get addicted to the opioids. And that's a real physical threat. So people, what I would say is, try combining it. You can combine it with opioids, but get off the opioids and get on your brain. Use it. The strain and pain lies mainly in the brain, and you can learn to feel good about your ability to enhance your control over your pain experience.
I think this conversation's been a very eye-opening conversation for me in terms of my approach to this topic, and hopefully for a lot of our listeners as well. And in that vein, if you were to look to the future, what do you see the future for this topic and how it is used and brought into the mainstream? And do you think we'll ever get to a point where, you know, when you go in to visit your GP, that this is one of the options that they explore early on?
I sure hope so, Lewis. It was eye-opening even while your eyes were closing, I might point out. But I sure hope so. But I'll tell you this. The reason I built Reveri with my co-founder, Ariel Poehler, about 4 years ago, we started this, is I figured that if we just do enough research, we've published in the Lancet, leading British medical journal, and if we had shown the same kind of analgesia we got in that study with a drug, every hospital would be using it now. There's this prejudice that if you use it at your brain, it's not real, you know, and also there's a hell of a lot less money to be made with hypnosis than there is with drugs, right? You know, I don't have a cadre of ex-cheerleaders to go around to doctors' offices saying, "Oh, try this new hypnosis thing." But I think it is an underdeveloped, underutilized resource, and that's why we built Reveri. I want people to try it out, have the opportunity to better manage your pain, your anxiety, stop smoking, control your eating, focus better at work. They're all things you can learn to do with hypnosis without drugs. And my hope is that exactly what you said, that on a doctor's list of alternatives is try managing this with self-hypnosis. And many good pain clinics now, like the one at Stanford, have people who teach people self-hypnosis along with all the other things they do for pain. And I'm a physician. I prescribe meds. I'm not against meds, but in their place. And I think we have underutilized people's own resources to manage problems like pain and stress, anxiety, insomnia. And the drugs that are often used for them are among the most dangerous. You know, the drugs for insomnia, the drugs for anxiety are habituating, and they can sometimes add to depression. And so there's a time and a place for them. I prescribe them sometimes. But I think our first resort ought to be to teach people how to use their own inner resources to enhance their sense of control over mind and body. And so that's why I'm here. That's why I'm doing this. I want people to appreciate and take advantage of the resource that sits between their ears and help them use it to better advantage.
I really echo that sentiment. I mentioned earlier on that I've spoken to my GP and many health professionals around anxiety, stress, and they are very quick to offer things like mindfulness and meditation as a first intervention. I'd really, like to see us get to a stage where self-hypnosis, as you mentioned, is one of the early interventions that they offer. And in that vein, then, the last question I have for you, because I can tell this is a real personal mission for you to try and bring this further and further into the mainstream culture.
It is.
The last question I have for you is a question I ask every guest that comes on the show. And this could be, it could be to do with your work, or it could just be a family related answer, whatever comes to mind first. But right now, for Dr. David Spiegel, what makes life worth living?
Well, it's people and helping people. That somebody wrote that love is a form of social connection and giving meaning to life. So it gives my life meaning to think that something I'm doing might help a whole lot of people. And I have helped a whole lot of people, and I've heard from people that that's the case. That makes me feel good. But between people out there, anyone who can use this, and my family, my children, my grandchildren, where you can sort of extend your sense of what it means to help people by the sort of natural response of your grandkids when you make them laugh or you make them feel good. Makes me feel good. And when I can tell people things and teach them things that I know will make their lives better, that makes them feel good. It makes me feel good. That's what meaning in life is about. So that's why this is a legacy project for me. I just want as many people as possible to make this a first resort, not a last resort. And the thought that we could be helping hundreds of thousands, millions of people at virtually no cost to make their lives better, to just control pain, control stress, get to sleep, is what excites me and moves me. And that's what I want to see happen.
Beautiful, beautifully put. Well, I will link in the show notes below the Reveri app, all the links everyone needs. If anyone's listening or watching right now and they want to check out the app, please head into the description below and click the link, and that'll take you right there. Dr. David Spiegel, thank you so much for your time today. It's been an absolute privilege, and I hope we get to do this again one day in the future.
Thank you, Louis. I hope so too. Thank you very much. It's been a real pleasure for me to talk with you.